Howdy everybody, happy Poop Tip Tuesday. Hope you guys are having a great Tuesday. We have an excellent show today. I'm excited about today's show. We'll talk about stomach ulcers. Are they common? Should you worry about them? We'll talk about, is it harmful to take laxatives every single day? Is that an issue for me or for other people? We'll talk about how to get rid of belly bloating after a large meal. And I'll talk about, do you need milk? Is it something that you need? Is it good for your health? And more, and your live questions on today's Poop Tip Tuesday. Guys, let us talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin. Go Longhorns. And I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. Alright, so if you're joining me for the first time, my name is Dr. Islam, and yes, I'm an actual poop doctor. Yes, I am your poop guru. I try to give you the best tips and tricks to help out with your health every Tuesday. I go live to answer your questions you guys have sent me. If you want your question answered live, send me a comment down below or subscribe to a weekly newsletter. I'll put a link down below where you can get great tips and tricks to help out with your health. Hope you guys are having a great Tuesday. I need a huge favor. If you haven't already, don't forget to smash that like button. Like, share, and subscribe. And also let me know if you're watching this live or on the replay. Amy, it's good seeing you. B, it's good seeing you. And Mona Lisa, good seeing you guys on the live stream. Thank you guys for watching today. So we have a great show today, and I'm excited. It is freezing here in Lubbock, Texas. Don't like the cold. I don't like the rain. And so that combination of the two, I hate that. I just don't like it. I like the sun. I like the weather to be nice. And I just don't enjoy the cold at all. So it's not a fun time for me. Joyce, great seeing you. Paul, it's good seeing you. Amy, thank you for watching on the live stream as well. And Taz, great seeing you from Orlando. I'm sure it's nice and warm there as well. All right, so hey, Dr. Islam, are stomach ulcers common? Should you worry about them? Well, it's a very good question. So stomach ulcers actually may be more common than what you think. So ulcers inside the stomach are usually due to a couple different reasons. For one reason, it can be due to a really bad infection called H. pylori. Now, H. pylori is a bacterial infection inside that stomach that over time can really erode and irritate the stomach to cause ulcers to form. But a second common reason is that you actually may be taking medications to cause ulcers. So medications called non-steroidal anti-inflammatory drugs, or NSAIDs, so things like Aleve, ibuprofen, naproxen, Advil, sometimes even aspirin, can erode the lining of your stomach to cause an ulcer to form. Now, ulcers can present with a lot of different symptoms, but pain is the most predominant symptom that ulcers can form or can cause. And the pain can be really severe, it can be really tight right here inside your stomach. But other symptoms including having a poor appetite, weight loss, black stools, or you could be becoming anemic, or a blood count could be low as well. Now, if you are worried about an ulcer, or you worry that you have some, this needs to be investigated 100%, because ulcers over time have a chance of busting open, causing bleeding to occur, massive bleeding. I've had to treat patients in the intensive care unit who come in for massively bleeding ulcers. Also, that ulcer can cause a tear in the stomach to cause what's called a perforation, which is an emergent problem that needs to be fixed. And sometimes ulcers can be a cause or can lead to stomach cancer as well. So ulcers are common, they do occur, and yes, you absolutely need to worry about them. If you're worried if you have an ulcer, the only way that we can know for sure is to actually take a look with an upper endoscopy, see what's going on inside that stomach, see if there's an ulcer that's there, and potentially we can fix it at that time, or at least put you on medications to get that ulcer healed up. Great question that I got. Carol, it's good seeing you. Thank you for watching as well. Consuelo, it's good seeing you guys. Thank you for watching as well on the live stream. All right. Question number 2. Hey, Dr. Islam, is it harmful to take laxatives excessively? Very, very, very common question I get all the time when it comes to constipation. Am I taking too many laxatives? Can I get used to laxatives? Will my body get used to this? Is this a problem? Well, let's actually put a close on this very common question. So One of the questions I have to ask is, why are you taking the laxatives? Is there an issue going on that we can potentially fix? Is there something that needs to be investigated? We need to find out why. So there are a lot of different reasons why people could be constipated, but three main ones. Number one is called irritable bowel syndrome, in which you have pain as a primary symptom, but also constipation as well. Number two is slow transit constipation, meaning your colon just doesn't want to push things through. And this may be another reason why you're taking laxatives. Or number three, you could have a condition called pelvic floor dysfunction, in which the rectum muscles are not working. So the colon moves perfectly fine, but when it gets to the very end, those muscles are so tight that nothing wants to pass through. It's like having a toothpaste with a cap on, and no matter how much you squeeze, nothing's going to pass through. Now, laxatives are a very common first-line treatment for a lot of patients who have constipation. And I will tell you, taking laxatives are very, very safe. Things like Miralax work for a long time. It's a very safe and effective option. And there's very good studies to suggest that taking long-standing Miralax does not lead your colon to become lazy, lethargic, to not work anymore, and it's safe to be on that long term. But my question for you guys is why? Why are you having constipation? It's just something that we can help adjust, whether it's dietary changes, whether it's prescribed medications, maybe it's more fiber, maybe it's adding magnesium, maybe it's helping out those rectum muscles. I want to find out why you're constipated. And once I find out why, I want to get you on a more effective plan to get you going, whether it's dietary changes, maybe it's continuing your laxatives, maybe it's making a slight change, adding like some magnesium in your diet, maybe it's putting you on some prescribed medication. These are very safe things to do, and I want to see if we can help you. But by and large, it is very safe to be on long-term laxatives. However, we want to find out why. And as always, make sure you speak to your healthcare provider to get their opinion as well. All right, Sean, it's great seeing you. Thank you for watching on the live stream as well. All right. Question number 3. Hey, Dr. Islam, how do I get rid of bloating after a large meal? The bloat question. Yes. Such a common problem that so many people have, and it is a very difficult problem for us to know what to do, because bloating can be due to a lot of different reasons. Sometimes it's constipation. Sometimes it's changed in your gut microbiome. Sometimes it's too much fiber or too little fiber. Maybe you're not going as effectively as what we would like. Maybe it's bad bacteria. It's a lot of different reasons. So, when it comes down to it, there are a couple of different suggestions I have for everyone when it comes to bloating. For some people, this will work. For others, it may not work as effectively. We may have to do further investigation. So, tip number 1 on what you can do to help out with bloating after a large meal: stay hydrated. Yes, drink a lot of water. So I'm not saying Coke here. I'm not saying carbonated drinks. Water, water, water. Water is safe. It's effective. It's natural. But not only will water help out, it will actually take up more room in your stomach, allow your food to get more moisture, and allow it to slip through a little bit easier to help out with the bloating. That's tip number 1. Tip number 2, take a walk after you eat. I cannot tell you how effective doing something as moving, taking a walk, getting things going will help out with bloating and bowel issues. Something as simple as that really, really does help. And an added bonus, go outside for a walk. It's beautiful out. We're getting to the springtime, the summertime. It is nice. It'll help out with your mental clarity to kind of think things through, and it will work really, really well. Number 3, eliminate, get rid of carbonation. Whether it's Coke, Diet Coke, beer, anything that has fizz, this is going to make bloating worse. Guys, come on. If you're having bloating, you can't add more gas into your stomach. That doesn't make any sense. Get rid of that. Eliminate the carbonation. Number 4, consider adding some teas. Yes, peppermint tea works fantastic. Ginger tea works great. Fennel tea is so awesome. Use this. This works out to help soothe your gut, get things going, helping out with the bloat, helping out with the cramping. This is really an effective option. Number 5, chew slowly. There's so many of us that just gobble down that food, and we're actually swallowing a lot of air. We may not realize this, but we are. So if somebody complains that you're a sloppy eater or you eat too fast, slow down. You're not going to be ingesting as much air. That's actually called aerophagia. It's an actual medical diagnosis, and this will help prevent the bloating. Number 6, if you're using a straw, don't. No. Whenever you're sucking up with the straw, you're actually ingesting more and more air. That's going to make bloating issues worse. So don't use a straw. And then lastly, let's go into my next topic, eliminate dairy. Absolutely. Dairy causes so much bloating for a lot of people. But not only dairy, things like cheese, milk, ice cream. This can really cause bloating issues to occur. So these are my 7 tips I recommend to everyone who has bloating after eating. And I will tell you, by doing some of these things, you actually may notice that your bloating goes away. So, perfect. All right. Erica's good seeing you. Amy's good seeing you as well. Yes, Amy, chamomile tea. That's the way to spell it. Chamomile tea. That's exactly right. It works really, really, really good. All right. So Taz, great question. Thoughts on IV guard for someone not diagnosed with IBS, just gastritis? When the peppermint in the product cause issues with someone with gastritis? Yes, great question. So Taz, you are right. So if you have issues like heartburn or reflux, peppermint tea or peppermint supplements can make that worse. It actually opens up that sphincter between the esophagus and stomach. So yes, now it doesn't happen to everyone. And for some people, it may be just a higher dose of peppermint that you're taking. And so just experiment with your body and see how you do. But yes, peppermint does make reflux symptoms and gastritis symptoms a little bit worse. I would just experiment to see exactly how you feel with that. Great question. All right. So question number 4. Hey, Dr. Islam, do you even need to drink milk? All right. I love this question. So in my opinion, milk does not do your body good. No, 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 no. The milk that we have currently has so many antibiotics, so many hormones. We know that it's not good for you. We know that there could be a rise in cancer, could be a rise in gut issues, changing your gut microbiome. So what is all the hype about the milk? Why were we pushing milk for such a long time? Well, a lot of it has to do with government, the dairy farmers, marketing, sometimes, I don't know, other factors playing a role in terms of pushing the need for milk. And also there's also has been this push to try to get as much calcium as you need because of the concern for osteoporosis and osteopenia. Well, let me break it down for you. You actually don't need milk to get the calcium that you need. You can get this easily by either a calcium supplement or having the right variety of diets that have a lot of plants and vegetables that actually already have natural vitamin D in them. And so you actually don't need dairy to do that. But not only that, dairy for a lot of our patients causes so many issues. You may not realize this, but you could be lactose intolerant. In fact, it actually can occur over time as you get older. So for me personally, I loved milk. I had cereal every single night. But then as I got older, I started noticing, hey, I'm having a lot of bloating, a lot of gas. What is going on here? And I soon realized I developed an intolerance to dairy. So for a lot of my patients who have diarrhea and bloating, one of the first things I recommend to get rid of is dairy. Yes, dairy. Simple thing that you can do. You don't need it. You already have the calcium in your diet to get you the diet that you need and get you the vitamins that you need. And there really is not anything good with eating dairy. There's very few benefits and a lot more side effects with that. So in my opinion, don't worry about dairy. Get rid of it. If you like the dairy taste, try almond milk or cashew milk. Maybe things like some alternative to dairy. But with the hormones and the antibiotics put in dairy and in cows, I am not of the opinion that you need dairy. And certainly you don't need it to help out with your gut. Great question. All right. Perfect. All right, guys. Well, I'm going through the list here to see if there's any more questions on today's. Sandra, great question. Does high sugar diabetes cause diarrhea? Absolutely, it does. So let's talk about this. So diabetes is such a difficult problem to have, but not only that, it causes a lot of gut issues. Your diabetes can actually really affect your gut. It can cause a lot of different reasons. Number 1, it can cause what's called diabetic diarrhea. Absolutely. Number 2, it can make you more likely to have a change in your gut microbiome, to have a condition called small intestinal bacterial overgrowth or SIBO, which can cause diarrhea as well. Number 3, you can have a condition called gastroparesis, in which your diabetes actually affects your stomach to cause a slowing down of your gut. That can present with nausea, vomiting, abdominal pain, bloating, all sorts of gut issues as well. And sometimes the medications we put you on for diabetes can make your diarrhea and gut issues worse, like metformin, Trulicity. These are medications that we use commonly for diabetes, but that can actually make gut issues a lot worse. So yes, not only can diabetes hurt your gut, the medication we put you on for diabetes can also mess up your gut as well. It can get you all jacked up. Great question, Sandra. All right, perfect. All right, guys. Well, I don't see any more questions. Paul, it's good seeing you. Thank you for watching on the live stream as well. I don't see any more live questions on today's video. All right, guys. I want to thank you guys for watching. If you have any more questions, please comment down below. As usual, if you want to get on my weekly newsletter, click down below. I'll put a link down below where you can get great tips and tricks every single week. And every Tuesday, tune in. I'll be here next week as well, guys. All right, perfect. All right, guys. So thank you guys for watching. Hope you guys have a happy and healthy day. See you guys tomorrow. Take care. Bye.